Spinal anesthesia, also known as spinal block or subarachnoid block, is a type of regional anesthesia commonly used in surgical procedures and childbirth. It involves the injection of local anesthetic medication into the cerebrospinal fluid in the subarachnoid space of the spinal cord. Here's how spinal anesthesia works and its key features. Administration. A needle is inserted through the lower back into the subarachnoid space, which contains the cerebrospinal fluid. The medication is then injected, usually below the level of the spinal cord termination. Local anesthetic. The medication typically contains a local anesthetic such as lidocaine, bupivacaine, or ropivacaine. These drugs block the transmission of nerve impulses by inhibiting the sodium channels in nerve cell membranes. Onset and duration. Spinal anesthesia generally takes effect quickly, usually within a few minutes. The duration of the anesthesia depends on the type and concentration of the local anesthetic used. It can last for a few hours, making it suitable for short to moderate duration surgeries. Level of anesthesia. The level of anesthesia can be controlled by adjusting the volume and concentration of the medication injected and the patient's positioning during the injection. This allows for different levels of numbness depending on the surgical requirements. Advantages. Provides rapid onset of anesthesia. Requires a relatively small amount of anesthetic medication compared to general anesthesia. Patients are usually awake and aware during the procedure, which may be desirable for certain surgeries or situations. Disadvantages. Potential for hypotension, low blood pressure, which can be managed with fluids and medications. Risk of headache, especially if the dura mater is punctured during needle insertion. In rare cases, nerve damage, infection, or allergic reactions to the medication may occur. Applications. Spinal anesthesia is commonly used for surgeries involving the lower abdomen, pelvis, and lower extremities, such as cesarean sections, hernia repairs, and orthopedic procedures. It is also used for some diagnostic and therapeutic procedures. Overall, spinal anesthesia is a valuable technique in modern anesthesia practice, offering effective pain relief and surgical anesthesia with relatively low systemic effects compared to general anesthesia. However, like any medical procedure, it carries certain risks and requires careful monitoring and management by trained healthcare professionals.